A technical failure.
A technical glitch.
Was a technical error in
technical issue around case uploads.
A technical glitch or gross incompetence. The UK government decided to embarrass themselves by making a silly human error when reporting on COVID data, leading to thousands of potentially infected individuals not being traced. Did you know this was one of the obvious mistakes that made the news? And there are a number of underlying issues with the way this data is reported. Join us today at the Data Cog to learn more. The COVID data is collected in the UK by various organisations, as the UK healthcare system is largely devolved between the four nations. Take, for example, the Department of Health and Social Care, which is led by Matt Hancock, is responsible predominantly for matters in England. Its executive branch is Public Health England. Similarly, in the other nations, there are a number of other public health branches. To complicate matters further, each nation reports to their own independent statistical authority. For England and Wales, that's the Office of National Statistics, and for Scotland, it's the National Records of Scotland, and for Ireland, it's the Northern Ireland Statistics and Research Agency. The daily coronavirus briefing is generally driven from the Department of Health and Social Care and the Office of National Statistics data.
Next slide, please.
The data flow is as follows. NHS trusts, alongside other bodies in the different nations, report the daily testing, cases and deaths data to their respective public health bodies. This is then reported to the Department of Health and Social Care, which of course is reported in the multiple dashboards that you see in the media and the Department of Health and Social Care's website. Looking at England, there are two main sources where the data is obtained from. The Public Health England, which is fed to the Department of Health and Social Care, and the Office of National Statistics. Public Health England, at the start of the pandemic, were only reporting deaths for individuals that died in the hospital. Other nations were also reporting community deaths. This was revised at the end of April. Let's take an example. Imagine an individual was tested positive for COVID. They managed to recover within the 14 days. Some 7 weeks later, they were involved in a tragic car crash. Since the person had tested positive for COVID once, this death would be reported as COVID death. If this sounds ridiculous, it absolutely is, and this practice was only appearing in England. After a review, this was revised in August, when the overall death numbers were revised down. As you can see from the graph below, just for 2 months, over 3,000 incorrect deaths were reported. There are also some timeliness issues with this data. When a death is reported, it is collated by the Department of Health and Social Care and is used on the daily briefing. The daily death data is prone to change as the death is yet not registered. However, when the death is registered, it is on the Office of National Statistics register, and that data is much more comprehensive, but unfortunately it is less timely. The Health Foundation analysis found that the Department of Health and Social Care's reporting is out by at least 2 to 4 days, where only 20% of the data is exactly from the day before, and 70% is from 2 to 4 days before that. On the other hand, the Office of National Statistics data, whilst comprehensive, is out by more than 2 weeks, as there are allowances of up to 5 to 8 days to register a death. These are in turn recorded by the next available Friday and only published 11 days later on a Tuesday. Over and above some loose calculations for the death data and some timeliness issues, here's a graph that shows a comparison between England and Wales on new hospital admissions. From an initial glance, it doesn't seem as striking. However, when we adjust this for population, the graph looks very worrying. This isn't due to Wales having a lot more admissions than England, but rather due to different ways of calculations. Remember, England's population is roughly 19 times larger than Wales. The screenshot below shows a view from a COVID data collection website. Notice how the UK is one of the very few countries not recording the COVID recovery data. Earlier in the year, The Guardian reported that Britain is an outlier internationally in not reporting the number of people who have recovered from COVID-19, alongside statistics on deaths and number of identified cases. The UK's failure to report how many people have recovered from COVID-19 has been criticised by many public health experts, who say a huge proportion of cases have remained invisible to the health service. To conclude, whilst we are waiting for a vaccine approval in the UK, it is imperative to have accurate data to ensure we can make informed decisions on lockdowns, community virus spread, and the infectiousness of this terrible disease. As ever, poor data costs lives. Thank you for joining us today.